payers in your system. And so about half of the rest of the difference is due to higher prices. In fact, Canadians get more of some services than Americans. We get fewer of some high-tech services. But even in the high-tech end, like for lung transplants, Toronto is an international center. We do more lung transplant surgery per capita than the U.S. So the first couple of lessons would be that that single-payer or a national health insurance program is going to be cheaper because it will have lower administrative overhead, and secondly, because it will have lower prices. And then a national health insurance program or single payer also means that everybody is covered. And even the problems with Canada's health system, and we do have them, we do have longer wait lists than you folks have for a lot of elective care, notwithstanding some of the high-profile cases in your country of Canadians who apparently couldn't get care for urgent conditions. They're just not true. Canadians who have urgent conditions do get care right away, but we wait longer for elective care than Americans. But on the other hand, Americans wait longer for an appointment with a specialist or elective surgery than do the French or the Germans. And so even the problems in Canada's system, I think, are illustrative to you folks, because a lot of our problems, like the wait times that we have nothing to do with our national health insurance system. And in fact, using process improvement techniques that have been pioneered by Americans largely through the National Institute of Medicine and the Boston-based Institute for Healthcare Improvement, in some parts of Canada in the last few years, wait times have plummeted. In Toronto, for example, it was common for people to wait up to a year for cataract surgery or joint replacement surgery up until 4 or 5 years ago. Now there are assessment centers that people can refer themselves to. They can see a specialist quickly, and from the first phone call to getting their eye surgery or joint replacement surgery now is only taking something like 4 to 6 weeks in Toronto without much more money, but simply with process improvement in healthcare. So our good points, I think, are certainly illustrative for you, that they demonstrate what any economist teaching first-year class could tell you, which is that single payer will reduce administrative costs. And then even our problems like waits for care are illustrative because they show that they're not really due to the fact that we have national health insurance. They're much more due to problems within the system and the way that administrators and doctors in particular have organized their practices.
And Dr. Radcliffe, we just have about a minute left, but you raised this very interesting point about the issue of choice. We hear a lot in this country about how we want to have free choice of doctors, but it's actually Americans who are restricted by these having to choose within your plan for a doctor.
Yes, that's right. I mean, I'll give you an example. A cousin of mine in Toronto a few years ago was told that he needed a gastroscopy examination of his stomach through an endoscopic tube. He was originally told by his family doctor that the usual specialist he referred people to would take 15 weeks, but he used a public website for the College of Physicians and Surgeons in Ontario and found a gastroenterologist who could do his procedure the following week. His family doctor made the referral, and he had his procedure. So you can choose any doctor you wish in Canada. They might not always be able to see you, but we have completely free choice of care. And as you mentioned, many Americans do not these days.
Dr. Michael Radcliffe, finally, the answer to the question that is continually posed by those who oppose any kind of public plan, and that is having a bureaucrat between the doctor and the patient. Your response to that?
That there certainly isn't the kind of formal rationing that people have been describing in your country, or we don't have death panels in this country, for example, that the decision about treatment is made actually just between the doctor and the patient. The insurance plan is virtually never involved, and ironically in your country, it's the private insurers that often stand between patients and physicians. You have to finance healthcare some way, and then there have to be some decisions made about about what's covered and how you're going to organize those services. In our country, we've made the choice to have it as a public insurance plan and to make those decisions democratically. And somewhat ironically, in your country, those decisions, they're left to somebody, but in this case, they're left to private insurers who appear to be a whole lot less accountable than our elected politicians are in this country.
Dr. Michael Rachlis, I want to thank you for being with us. His latest book, Prescription for Excellence, How Innovation is Saving Canada's Healthcare System. That does it for our broadcast. Happy birthday to Kellen Innocent. Democracy Now! Produced by Mike Berkshire, for the producer, Amata Angeli, Comment, Steve Martinez, Nicole Salazar, Hanima Sud, Robbie Karen. I'm Amy Goodman, the Truth, Red Duluth. Thanks for joining us.